Let's study about radial nerve. Radial nerve is how it is originating, how it's supplying to the arm and forearm muscles, and what is the root value. So as we can see here, this is the radial nerve. Okay, it is originating from the posterior cord. We have learned in the brachial plexus that it posterior cord have 5 branches. Among that, R is for radial nerve. Okay, so it's coming from the posterior cord, and what is the root value? As we trace it down, it is having C5, C6, C7, C8, and T1. So it is the largest branch of the brachial plexus. Okay, so let's see how it's running to the our hand. So this is the humerus. Okay, and it comes from the axilla. Then in our hand we have one spiral groove, as we all know. Okay, it comes and enters the spiral groove and now travel the lateral aspect of our arm, and then here we have one cuboidal fossa. Then what it will do, it will come, enter, and here is one muscle, that is supinator muscle. Okay, it will split here into two. Okay, and then let's like this. And then it will all go like this, and I will explain it. So first let's write over here in the axilla. In axilla, to which muscle it is supplying? Okay, in axilla it is supplying to the triceps muscle. Triceps muscle we have which one? The medial head and the long head. Okay, now before entering to the spiral groove over here, we have one triangular space. So it will enter through that. In the spiral groove, it will supply in spiral groove. There is lateral head and the medial head of triceps. Okay, it is coming all that way, enters the triangular space. Then in the spiral groove we have two muscles, lateral and medial head is there, so it will supply that and comes to the lateral part of our hand. Okay, in the lateral part it is supplying two muscles, which can be, yes, the lateral muscle we find in our hand is brachioradialis, and the second is extensor carpi radialis longus. Okay, now we have over here lateral epicondyle. Yes, so over there. After that, it enters the forearm. It enters the cubital space, this one, and then it comes to the forearm. In the forearm, it will supply to the one muscle, that is supinator muscle. Okay, in supinator muscle, it will divide into two. First, posterior interosseous nerve, and this is the superficial branch. Now, the superficial branch will come all over the hand. Okay, this is our hand. So, superficial muscle, it is coming laterally like this. It is dividing. One will go to posterior interosseous and one will come like this. Okay, so the posterior interosseous nerve will supply all the extensor muscles, that is deep and superficial muscles. It is supplying by posterior interosseous nerve. And what the superficial branch will do? superficial branch will come to the skin of dorsum of hand. Okay, so here what we have, here we have our nerve box, and it is supplying to these muscles. Okay, in hand, if I will show this part to you. So third finger like this. Okay, in this, let's separate it with one color. This is our nail bed area. Okay, so I want to say you that in our hand also we are having our some nerves supplied by radial nerve. So this part, 1.5 finger, is supplied by ulnar nerve because this is ulnar side. Okay, and this 3.5 finger, this is supplied by radial nerve, including our anatomical nerve box. What about the bed area, nail bed area? This nail bed area is supplied by median nerve. Clear? So let's revise it again from starting. That in our hand we are getting nerve supply from the 5 major nerves, that is musculocutaneous, axillary nerve, radial nerve, median nerve, and ulnar nerve. We are studying now radial nerve. Radial nerve is originating from the posterior cord, having the root value C5, C6, C7, C8, and T1. It is the largest nerve, and it supplies to the posterior compartment of our arm and forearm muscles and the dorsal surface of our hand. So it's coming from the brachial plexus to the axilla. In axilla, it will supply to the medial and the long head, and then it comes to the triangular space of the arm, goes to the posterior compartment and supply to the in spiral groove lateral and medial triceps. Okay, and then come to the lateral side of the hand and supply to muscle brachioradialis and extensor carpi radialis longus. And after here, it's go into the cubital fossa. It is the lateral most nerve present in the cubital fossa. Okay, and then pierces the supinator muscle after it getting divided into two, superficial branch and deep branch of posterior interosseous nerve. Okay, the deep posterior interosseous nerve will supply all the extensors. Okay, extensors muscle, and the superficial branch, it is forming cutaneous branch of the hand and supply the skin. We can say sensory supply of the skin of the dorsum of the hand. In the hand, 3.5 finger is supplied by radial nerve, 1.5 finger by ulnar nerve, and median nerve is supplied by nail bed area. Nail bed area. Okay, so now we have done the it's how it is coming and supplying to the arms and forearms muscles. Let's do now their injury. What will happen if they get injured? So there are two type of lesions. There is high lesions in the part of axilla. Okay, in part of axilla or spiral groove. Okay, so what will happen in the high lesions and then low lesions? In low lesions, what we will see? Yes, at the injury of the our lateral epicondyle or injury to posterior interosseous nerve, what will happen to that? Let's see. In higher lesions, so in higher lesions at the place of axilla. Okay, if I have to ask one question, if, see, this place is getting injured, which place? In the place of axilla. What will happen? What will happen? Will triceps muscle work? No. Triceps muscle will not work. What is the function of triceps? Extension of the elbow. So, there will be no extension, so flexion is seen. Okay, then what will happen? Brachioradialis muscle will work? No, they won't work because they are not. They are helping to the elbow joint. Okay, and extensor carpi radialis longus. This is also involved, so it is extending our wrist. If it is injured, there will be wrist drop. Okay, then after posterior interosseous nerve is also injured. So what will happen? There will be finger drop. All the extensor like extensor digiti minimi, extensor indicis, extensor digitorum are affected. So there will be loss of the extension of the fingers. So there will be flexion of the fingers, or we can say finger drop. What about the superficial? Yes, superficial sensory loss is also found. Okay, so let's note it down. If axilla is affecting, so what we can see? In axilla, there will be flexion of elbow. Why? Because triceps muscle is involved. Triceps muscle is injured. Flexion of elbow. Next, what we can see? We can see wrist drop. Why? Because ECRL is injured. Wrist drop. Wrist drop. Third, what we can see? Posterior interosseous nerve is damaged. So finger drop. Finger drop is seen because posterior interosseous nerve is getting. If posterior interosseous nerve is getting, superficial branch is also affected. So sensory loss. Where? Dorsum of the hand. Okay, dorsum. Why? Because superficial branch involved. Understood? Now this is the axilla, and the most common injury of the radial nerve in the axillary region is because that people use crutches. You know crutches, that Baisakhi. Yes, because of that, it is the handle, the padded area of that is getting placed at the axilla, right? When we are using Baisakhi, so that affect the radial nerve injury. Now, second injury is at the place of spiral groove. Okay, what will happen at the spiral groove? So let's note it down again. This is the spiral groove. If a spiral groove is there, so can we see the triceps muscle involved? Yes, triceps muscle is involved lateral and medial head, but not the long head. So we can say there can be not total palsy, but there is weakness of the extension of the elbow. Okay, there is no total palsy, but extension of the elbow is reduced. Okay, and then will brachioradialis extensor carpi radialis longus affected? Yes, there is. So wrist drop is seen. Now comes the posterior interosseous nerve and superficial branch. Will they affected? Yes, they will be affected. So extensors of the finger is lost. Finger drop is seen. Superficial branch? Yes. Superficial branch is also seen over here. So let's write it down. Flexion of elbow, not flexion we can say, but weakness. Weakness at extension. Extension of elbow. Okay, because some muscles are not affected, they are spared. Second, wrist drop is seen. Yes, wrist drop is seen. Wrist drop is seen because ECRL affected. Now, third, finger drop. Finger drop is also there because posterior interosseous nerve is affected. Sensory loss will be there, present at the dorsum of the our hand because superficial branch is affected. Okay, so we have done the higher lesions, And what is a common injury of the spiral groove? At the spiral groove, yes, there is one palsy. This is crutches palsy. This one is crutches palsy. This will be Saturday night palsy. Saturday night. Yes, Saturday night's name came from some few era back. People used to celebrate the we can say they used to celebrate the weekend, Saturday especially. So at that day they used to drink whole night, and they used to they put their arms in that way to the chair that the arm where our spiral groove is there, it sits on the chair. So because of that, the radial nerve is injured. So the name came from there, Saturday night palsy, spiral groove, at the location of the spiral groove. Now let's do the lower lesions. This is the about higher lesions. Now lower lesions. Okay. Where we can see the lower lesions? First at the location of at lateral epicondyle. Okay, let's trace it down again. Okay, this is our lateral epicondyle. In lateral epicondyle, what can be seen? Is brachioradialis muscle is affected? No. Not ECR are also affected, because the insertion is from here or there. Okay, it is spared. Yes. So no wrist drop is seen. What about posterior interosseous nerve? Yes, affected. Superficial, affected. Okay, so let's write it down. So here, and yeah, before that all the muscles are working. No, they are spared because we have the lesions over here. Okay. At the level of cubital fossa, we can say. So, our brachioradialis muscle and extensor carpi radialis longus muscle is before that, not at the very same position of the cubital fossa. So, it is totally spared. We cannot see the wrist drop. No wrist drop. What about posterior interosseous nerve? Yes, so there is finger drop. Next, we have sensory loss, because sensory branch is also affected. Now, second is lower lesions at what place? At injury at posterior interosseous nerve. Let's see our pathway of nerve. Axilla spared, spiral groove spared, these muscles spared, posterior interosseous. Okay, where we can see posterior interosseous nerve affecting, in which type of injury? Yes, we can say during surgery, we can say, or during fractures, posterior interosseous nerve is injured. So, will superficial branch affected? No. No superficial branch is affecting. Only posterior interosseous nerve is affecting. So, there will be no wrist drop. Yes, no wrist drop. Finger drop will be there. Yes, finger drop will be there. Sensory loss? No sensory loss. Okay, patient will come how? Patient will come to you as the finger drop is there. There will be flexed finger. Okay. Other things are normal. The superficial branch is working. There is no wrist drop. Okay. So person will come to you with the finger drop sign. Over here, there will be finger drop with sensory loss. What about these two? In these two, the elbow will be flexed. Okay, there will be wrist drop, finger drop, sensory loss. Everything is seen here. Okay, and here extension muscle is spared at the elbow, so there will be little flexion, we can say, of the elbow. Other things are same as the axillary region. So if you have any query, comment down and subscribe for more.